you are following a textbook. It's a cookbook. You just follow the cookbook. And this cookbook generally, 90% of the time is going to serve you very well, you know. But it is true that over the course of time, you begin to learn how to improvise. And this improvisation comes especially when cases are more complicated. That's where you draw upon your experience of treating other patients to see how best to help this particular patient. And that is why that's the important difference I see between what a younger oncologist may do and what senior oncologists may do.
Thank you very much for that, Doctor. So let's go to another topic about breast cysts. This is also very common. Is there a better approach for this? Because when patients go to different doctors, they get confused. One wants to operate, one does want medical just management.
Okay, let me be very clear. All right, breast cysts do not need to be operated on. I say it one more time. Breast cysts do not need to be operated on. As long as you say the word is a breast cyst, no need to do any surgery. In actual fact, that's the main distinguishing factor. When we do an ultrasound of the breast, we distinguish between those that are solid lesions and those that are liquid. Solid, you have to pay careful attention. It can be benign nodules like fibroadenomas, all right, or it could be something more ominous like a carcinoma. But when it's a cyst, that one you rest assured, no surgery is required for breast cysts.
How about biopsy?
Breast cysts cannot be biopsied. Breast cysts can be aspirated. You can put a needle in. Sometimes patients complain of very painful breasts because the cysts are engorged. They're full of water. And many of these patients who come to see me, I don't even send to the surgeon because it's so simple. I just stick a needle, suck it out. You know, if I want to be very careful, I send the cytology just to prove that it's not cancerous. But 99.99% it is not cancerous when it's a cyst. That's why it should not be operated. Now, if it's a solid lesion, that's a little bit different. You have to look at the features of the ultrasound. Some of them are very clearly benign looking. They do not require any surgery. But if there's any suspicion, you can always do a needle aspiration to see whether they're cancer cells. This can be done very simply in the clinic, does not require anesthesia, nothing at all. And it's literally a 2-minute procedure.
How about the BIRADS staging?
The BIRADS is usually used, is more applicable when you're talking about the BIRADS on a mammography. That's not on an ultrasound. And that's often referring to the BIRADS of the solid lesions. Yes. Cysts, generally, we just say these are benign cysts. We don't give it a BIRADS rating.
So you don't say if it's more than this BIRADS?
Well, BIRADS is a general classification, 1 and 2.